So chronic pain. Chronic pain is something that's very systemic in most societies. What I find as a specialist is a lot of patients have tried certain things, and meaning treatment possibly from a therapist or their primary care doctor. And the vast majority of the time, those types of things can help people's pain and sometimes even make it go away. What I find is there are patients out there that are still dealing with chronic pain because they've gone through the normal regimen that most patients would respond to, but they haven't. And a lot of times those regimens are dictated by physical therapy or their primary care doctor. And they've gotten better, but they haven't, the pain has not gone away. And again, what we find with this is patients stop doing certain things. They stop doing some of the things that they enjoy doing. And what I try to do is find out, what is the true diagnosis? A lot of times patients say, well, I was just told I had neuropathy, which is a very general term, or back pain, or neck pain, or what have you. Or let's say that they've had a workup, but the doctor told them, well, there's not a lot going on by looking at the report. The difference with seeing a specialist with something like that is I never only get an MRI report or an X-ray report. I'm going to get the imaging that is needed and then actually preview this with the patient. And the reason that's beneficial is because I know where the pain is after evaluating the patient, and then I can really meticulously go through the MRI, because sometimes radiologists miss things. We all miss things. And sometimes I've had patients that have had pain for 8 years because the physician that they were seeing only read the report, and the report really didn't see a small disc protrusion, let's say, that's causing nerve root impingement, and it was missed. And so the patient was told, well, nothing's really wrong. The MRI didn't really demonstrate that anything was wrong. And then came and saw me, and then we go through the MRI with the patient and discovered that there was a reason for this, and then the appropriate treatment was remedied the pain. And so, coming and having chronic pain that has been supposedly treated and gotten better, but it's still there and is causing some reduction in your activities of daily living, well, then that's when, again, seeing a patient care specialist in that field will hopefully remedy that problem, or certainly provide a little bit better treatment outcomes. And a lot of times even the normal treatments that I would do for a patient don't work. And that's, again, the benefit of seeing a specialist, because there's more than one thing that can cause a particular pain. And that's the difficult thing with musculoskeletal medicine, is what we're dealing with a lot of times, especially in spine, is physiological responses, inflammatory responses, in other words, inflammation. That's what causes us pain. Most people have disc disease, degenerative changes, all of that, pinched nerves. Most of us get this stuff, but not everybody's having pain with it. It's all about the inflammatory responses. And sometimes what I thought would help a patient has no impact on them at all. But being able to offer differing treatment options for patients is ideal, and that gets better and better as the technology gets better and better. And so there's a lot of options for patients that, let's say, have just back pain. And sometimes you have to try something, and if that doesn't work, well, then there's other things to be tried as well. Because again, if somebody's had an injection, let's say by a physician, and they told them, well, that's as good as it's going to get, you've had 3, we cannot do any more right now. That may be true, but there may be another pain generator that wasn't diagnosed, and that could be causing some of the continued symptoms that the patient is having. And that's where, again, we try our best to offer a lot of options for patients. Again, trying the less invasive things, and then proceeding down the line as we need to try to mitigate folks' pain.